Hello, everyone. I'm Jim Garrison, and I want to welcome you to day 13 of Humanity Rising. Every day since the 22nd of May, we've been convening a 2-hour session from 5 o'clock to 7 o'clock p.m. Central European time, so that people from all over the world can come together during this extraordinary pandemic and share what's happening, discuss possibilities of human renewal, and take counsel together as to how we navigate our way through an unprecedented human event in a way that is constructive toward a world of sustainability and resilience and health and greater alignment with the natural ecosystem. Humanity Rising was an impulse that came out of the pandemic. It's powered by Ubiquity University. We're very grateful for all of you who are attending this Zoom session. We're being live streamed on Facebook and Awake TV and about a half a dozen other social media platforms. So we're going out to about 10 to 15,000 people each day. And we are profoundly grateful for the overwhelming response that we've had in literally 6 weeks' time. We're upwards of 350 plus organizations, nearly 400 speakers, and people and organizations are joining each and every day. It's an indicator of the depth of caring that people have at an extraordinary moment in our collective history, where for the first time in all of recorded history, virtually everyone, everywhere, is going through the same experience. And therefore, we're in the same conversation. As we begin today, I want to make a couple of comments about the way people respond to this level of crisis. Yesterday, I referred to this phenomenon that has been noted in history for the past 2,500 years. That in the aftermath of a calamity, the collective psyche tends to split. In the aftermath of an earthquake, for example, or flooding, some people will loot, destroy, steal, and other people will help and heal and do everything they can to bring back social order. This is a very complex phenomenon in the human society. There are a couple of distinct factors in the response to the pandemic on this occasion. Normally, leaders seek to calm, seek to heal, and seek to unite. But strangely, in this pandemic, the President of the United States, to take one example, is responding in a highly divisive, highly antagonistic, highly verbally violent way. And so as a result, the United States, rather than reaching unity, is disintegrating into further chaos. That was tragically exemplified last week with the killing of a Black man, George Floyd, who was asphyxiated as a white officer pressed his knee against George Floyd's neck till he died. In the aftermath of that, protests instantly sprang up all across the nation, and now in various regions all around the world. On social media, protests in the streets, as people are rising up and challenging this level of lack of compassion in the face of a collective trauma that requires a moral certitude and a moral compassion that is strangely lacking. We have a couple of responses that we can make as we get caught up, particularly in the United States, in what's happening. And I just want to take a very brief moment to refer to the work of Ilya Prigogine, who won the Nobel Prize for Chemistry back in 1996, about 25 years ago. He had an observation about chaos theory. He said that the strange thing about chaos is that while on the surface it appears to be a disintegrating phenomenon, if you look deeper, undergirding chaos is an underlying order. And that what happens during chaos is that there's a centrifugal force that begins to pull people and societies and families and communities apart. But if there is a countervailing movement toward coherence that slipstreams and interacts with the forces of chaos, what Prigogine called islands of coherence in a sea of chaos. If the islands of coherence can be more coherent, then the chaos is chaotic. The entire system can be uplifted to a higher level of order. And I think that's a very important point to make as the world convulses in the aftermath of George Floyd's murder, that somehow ignited people all over the world. Our task here today, your task, my task, in your family, in your community, as disorder seems to be gaining in the ascendancy, is to create such an intention toward coherence that not only does the chaos not impact you, but through the collective coherence of everyone of goodwill around the world, we can actually be empowered by the chaos and create greater coherence, such that in the fullness of time, when we reach a critical mass, the energetic of the entire world can be uplifted simply because we've maintained such an intense devotion to the coherence of our community. So I want to thank everybody that is showing up for this Zoom call. For the next several hours, we will be creating coherence. And we need to understand that the coherence that we generate here today, the coherence of all the organizations of goodwill everywhere, are interconnected. And even though we can't see it, in the invisible realms of the energetic forces and fields that unite all of humanity into one, we are doing what we can do in this time of trauma to be an agent of transformation. And that understanding is at the heart of Humanity Rising. And it's within this context that I want to thank everyone that's coming on this program from the National University of Singapore. We're in day 3 of our NextGen panels, where after 10 days of listening to the voices of women, we're spending 7 days to listen to the voices of youth. Because the empowerment of women and the empowerment of youth in the post-pandemic world is critical if we're going to shape a world that is sustainable, resilient, abundant, healthy, and in alignment with natural systems. So I want to turn it over now to one of the 3 Ubiquity University conveners who are moderating these panels, to our VP for Asia, Raji Jayasinghe. Raji.
Thank you so much, Jim. Thank you for your profound, as always, words, and much needed at this time. And thank you and welcome to everyone, our panelists who you will all meet soon, and indeed everyone tuning in from around the world, wherever you are. Today's session, as Jim indicated, will feature the National University of Singapore and their MBAs. And we'll learn a lot about what they're doing in the region to not only balance their studies, but also make an impact at this very critical time. Before we get started, just a few announcements. I would like to give you a very short recap of yesterday, for the simple reason that if you're interested and you missed it, you can always catch the recordings on the Ubiverse. So yesterday we had youth from all around the world, young leaders aged 18 to 26. We had representatives from Colombia, Algeria, Serbia, Indonesia, and they spoke to us on a very personal level on what they are doing in their home communities. From COVID-19 relief in Bangladesh to deforestation and supply chains in South America, Colombia, and even in post-conflict areas. So if you're interested in that, please do log into the Ubiverse and watch that recording, or indeed any recordings of every session that's taken place from the start of the summit. So with that said, I would like to pass over to my colleague Nora, who will read our mission statement. We like to do that at the beginning of each session. It's a statement that we drew up and that we hope represents the movement we're trying to create. We would love anyone's feedback on what you hear, because it's a working document and we'd like it to be as collaborative as possible. Nora, over to you.
Thank you, Raji. Thank you all for being here. I will read you our mission statement, as Raji just mentioned, because it's really important that you know what it stands for. So we are really here because this rising generation of decision makers and global citizens comes together with the shared understanding that our world is in crisis. We are the largest and most connected generation to ever exist. And we enter these conversations fully aware that our lives and those of our children hinge on the actions we take today. We share the responsibility to identify and implement solutions. We recognize that real change starts with our daily thoughts, interactions, and choices, and that each one of us has a unique role to play in our unfolding story. Lasting and regenerative change can only manifest through our collective intelligence and radical collaboration. Collaboration that is built on a spirit of diversity, tolerance, open-heartedness, and trust. We represent current and future generations in how we live our lives today. We seek to empower each other to alter the story we want to live. And we invoke creative solutions to innovate successfully for a more sustainable and resilient planetary society. So before we start, I would like us to take a moment of silence to connect to the heart, the center of integration and connection. And yeah, really a moment of silence is a period of silent contemplation, of prayer, reflection, or meditations, which in this time seem really to require, is really required more than ever. So if we can just appreciate this moment of being all together, you can close your eyes and feel your heart. Thank you all. I will pass it back to you, Raji, to get this panel started. Thank you and
Thank
enjoy.
you so much. We will get the panel started shortly, but first, one of my favorite parts of our NextGen week sessions. For those of you who haven't been at the others, let me just give you a quick briefing by letting you know that what we wanted to do as a NextGen panel was each day give some space and give some spotlight to art, expression, embodiment, because we feel that these forms of expression are just as important as anything else in a movement. So that's why today I'm very happy to be able to introduce to you a very close friend of mine. I have known Christina for, I think, well over a decade, 2 decades probably. And she's someone I look up to very much. She's someone I would say is really the embodiment of change from within. And she really walks the walk, she talks the talk as well. And so with that, and with lots of love, I will hand over to you, Tina, to take us through.
Hi, everyone. Christina here. So I am a yoga and a meditation teacher. And today I'm here to just bring a little bit of mindfulness into this topic. And the topic is about shaping a safer tomorrow. So when we talk about shaping a tomorrow, it really does start with us. So in the yoga tradition, the practice is always about trying to create this calm and grounding energy field that resonates from within you. So whatever you do, you are always empowered with this life force that we refer to as prana, or as in layman terms, it would be called the breath. So today, the technique that I'm going to teach you, if you've ever been to a yoga class, is called Pranayama, or a breathing technique. It is pretty easy. It doesn't matter whether you are never done yoga before, never done Pranayama before. And it is basically something that can be done at any point in the day. There are, of course, practices that you do either in the morning or in the evening. But this one can be done at any time if you ever need to calm your mind, if you ever need to ground yourself. The reason why we always say that the breath is such a huge part of a yoga practice or any mindfulness practice, because like one of the most important textbooks in the yoga tradition, what they ever said was, the mind is the king of the senses, but the breath is the king of the mind. So if you want to change your mind, if you want to shape your mind, the key is to focus on the breath. And I will take you to, there's 2 parts of this breathing technique that I'm going to teach you today, and hopefully that it's very easy to learn, and hopefully you remember to do this at any point during this session or whenever you feel stressed. The first part is called 3-part breathing, where we just breathe into the belly and then breathe into the ribs and then breathe into the chest. It's one smooth breath. You don't have to overthink it at all. And then once we do a few rounds of that, I will take you through to the main part of the breathing, which is a ratio breathing. And we're going to breathe in for 6 counts, and we're going to breathe out for 6 counts for a few rounds. Then the last bit, we breathe in for 6, exhale for 6, and then we hold our breath out for 4 counts. So if you can't do 6 counts, that's okay. You can do 5. And if you can't hold for 4, that's okay. You can do 2, 3. Whatever works for you, just try to follow with my count. That being said, let's get into it. If you are sitting up, you should be sitting up. You should be on a chair, or even if you are sitting on a couch, maybe not lean back, maybe lean a little forward. Let your spine be free. Let your spine be upright. Rest your hands on your thighs. Let your eyes close. It's always really great to have your eyes closed when you do a breathing practice. Just a few moments to just follow on your breath. So right now you're just paying attention to the rise and fall of your natural breathing rhythm. Now we just all exhale out together. And take a deep breath into your belly. Let it come into your side ribs and into your chest. Exhale, draw your navel back towards your spine. Let your chest decompress as you let it out. Let's go for 2 more like that. Inhale into belly, ribs, and chest. Exhale, draw your navel back. Let your chest decompress. Inhale into belly. Really expanding your chest. And exhale, navel back. Moving into our ratio breathing. Let's inhale for 6, 2, 3, 4, 5, 6. Exhale for 6, 2, 3, 4, 5. Navel back. 6. Inhale. 2, 3, 4, 5, 6. Exhale. 2, 3, 4, 5, 6. Let's keep going. Inhale. 2, 3, 4, 5, 6. Exhale. 2, 3, 4, 5, 6. Inhale, deep breath, expanding the ribs, allowing that breath to come all the way up to your chest, to your collarbones. Exhale, draw your navel back, letting all that energy flow out. Changing it up a little bit. Inhale for 6, 2, 3, 4, 5, 6. Exhale. 2, 3, 4, 5, 6. Now hold the breath out. 2, 3, 4. Inhale, deep breath in. Try to maintain that smooth breathing. 4, 5, 6. Exhale. 2, 3, 4, 5, 6. Hold. 2, 3, 4. Inhale. 2, 3, 4, 5, 6. Exhale. 2, 3, 4, 5, 6, hold. 2, 3, 4. Inhale. 2, 3, 4, 5, 6. Exhale. 2, 3, 4, 5, 6. Hold. 2, 3, 4. Inhale. Last round. 3, 4, 5, 6. Exhale. 2, 3, 4, 5, 6. Hold. 2, 3, 4. Release the control of your breath. Just allow yourself to breathe naturally, spontaneously. Bring your attention up to your eyebrow center, or to your third eye. This is your the middle of your forehead. Allow yourself to just pay attention to any sensation that you feel there. Every time that we lengthen our exhalation and we hold our breath out, we start to clear the lens of the mind, clear the lens of our intuition. Let that consciousness, that pure consciousness, come forward into our reality. If at any point you feel a bit lightheaded, you can always drop your chin down towards your chest a little bit. Start to deepen your breath. And slowly blink your eyes open. You might feel a bit, hopefully calm and hopefully grounded. The more you learn to control your breath, the more you learn to control the very, very thinking mind, the mind that keeps bouncing all the time. So with that, I leave you and hand it over back to Raji. Have a really great session, guys. Thank you very much for having me. Peace.
Thank you, Christina. Thank you so much. That was very powerful. I'm feeling quite tingly, if I'm going to be honest. But with that, and with that clear mind and anticipation moving forward, it's time for our session, and it's time for me to hand over to our panelists. So today we turn our attention to Southeast Asia, Singapore in particular, the National University of Singapore, which holds a special place in my heart because I did my MBA there. So it's with more than a little bit of pride that I introduce some MBAs representing the National University of Singapore to talk about their experiences and the work they're doing in the region. So let me hand over to Tulika, our moderator. All over to you, Tulika.
Thank you, Raji. A very good evening and a good morning to everyone who's listening. It's almost midnight here in Singapore. And I'm Tulika Poddar, the panel moderator for today. And I'm currently pursuing MBA at the National University of Singapore. And as the elected president of the NUS MBA, Sustainability, Ethics and Impact Club, I'm really passionate about advancing conscious leadership movement to my fellow MBA cohort, who will be the next business leaders of tomorrow. As Dr. Garrison rightly mentioned in his opening address, that it's the first time in the human history that everybody, everywhere is going through the exact same experience at the same time. And it's an extraordinary moment. We at NUS MBA also believe that as we struggle together to cope with this pandemic, it will lead to a beginning of a new era towards a more collaborative, resilient, and sustainable future. To that effort, I believe the Humanity Rising Global Solutions Summit is an excellent platform for the world to have these critical conversations and take an action together. I really want to thank the Ubiquity University and the entire Humanity Rising team for giving us this opportunity to tell the world our story. The panel here today is the part of NUS MBA Sustainability, Ethics and Impact Club's initiative towards helping our cohort create a very positive impact on the triple bottom line, which is people, planet, and profit. Rooted in its core values of awareness, sustainability, and empowerment, the club has previously organized events such as the annual Month of Giving, which is a series of volunteering and fundraising events, a social innovation case study challenge for business schools of Singapore, fire chats with industry leaders, and many more. Without further delay, let us hear from NUS MBA's very own heroes and heroines, Dinda, Marcel, Faiz, and Mushan, who will be sharing about the amazing work they are currently doing. I'm really honored to call them my fellow classmates. A quick note for everybody who's listening to us, you can type in your questions on the chat and we will have a Q&A segment at the end of the panel. Let's start with Dinda to introduce herself and her project. Over to you, Dinda.
Thank you, Tulika. And hi, everyone. My name is Dinda Puspasari, and I am a current MBA student at the National University of Singapore Business School. It is such an honor for me that today I could be here to become one of the panelists together with my incredibly inspiring colleagues. So I think it is important for me to tell you a little bit of where I came from and why did I finally make an initiative towards COVID-19 relief movement in my home country of Indonesia.
Dina, would you talk a little lower? You're distorting. Thank you.
Okay. So yeah. Is it better now?
Yeah, a little bit lower.
Okay.
Yeah, thanks.
Okay. In 2017, I built my own company in the food and beverage sector. In just under 3 years, my company has grown into owning and managing 7 franchise restaurants across Indonesia. 1 high-end dining restaurants in Jakarta, and we are also planning to import our own wine to Indonesia by 2020. However, as what you already knew, 2020 gave all of us surprises. Just 1 week after the grand opening of my high-end dining restaurant, COVID-19 cases in Indonesia spiked and Jakarta became the center of the epidemic. So the government decided to apply large-scale social restrictions that include all restaurants to cease all dine-in operations. Unlucky for us, our high-end restaurant only offered dine-in, and so we needed to close the restaurant until further notice. And though our other restaurants are still operating, but sales had dropped by 90% for these past 2 months. So I had no choice to started giving 70 employees of my high-end restaurant unpaid leaves. It broke my heart to see their faces when they heard they won't get any salaries for God knows how long. And some even approached me to beg because they have kids and families to feed. And also on my way home on that day inside the car, I also saw the informal workers on the street not knowing how they could get something to eat, and the slum areas where the people basically have no idea what social distancing is. So I came up with this idea to make rice boxes to donate. It happened to be the same time as Ramadan, or also known as the fasting month for Muslims. When some of my friends heard about my plan, they offered to donate some money because they said they did not know how to reach those people in need. That is when I turned this idea to become an initiative called Iftar for All. In this initiative, I basically collected money from the donors and turned that into rice boxes that I would deliver to the slum areas around Jakarta every Friday. And it was so heartwarming to see how many people actually cared and were willing to donate. And at the end of Ramadan, we could deliver a total of more than 1,000 rice boxes around Jakarta. So yeah, on behalf of the people who had received these donations, I'd like to send our gratitude to everyone who has donated and supported in any way. Yes, thank you.
Over to you, Faiz.
Dina, stop share, please.
Yeah.
Yeah.
All right. Hi, everyone. I'm Faiz. I'm a nurse, and I'm currently working in the front lines caring for COVID-19 patients in our community facilities. So Singapore was fortunate enough to have been admitting all COVID-19 infected patients to the hospital up to the end of April, I think. And during that time, my team and I were tasked to set up a community isolation facility for COVID-19 patients who have passed the symptomatic or infectious stage of their disease. This was done to alleviate the burden of care for the hospitals and to ensure that the sicker patients get the appropriate facilities for their care needs. About a month ago, slightly more than a month ago, we moved on to open up a huge facility comprised of several exhibition halls. One such hall could accommodate up to about 900 patients. And as of now, we have about 9 of these halls operational. Most of our guests in the halls are made up of migrant workers who are laborers, mainly from South Asia or China, who have come to Singapore to work in the construction industry. Singapore has categorized its infection cases in waves, and the last and the biggest wave thus far comprised of these migrant workers living in purpose-built dormitories in Singapore. Just to give you a figure, it's around 94% of all cases, and that's around 33,000 out of 35,000 confirmed cases in Singapore. That's a huge percentage. So what we do in the front lines is really basically at the start was just to care for their body, but there was no focus on caring for the heart or the mind, as we found out when we progressed through the days. And you can see that the longer they stayed in those facilities, the more their heart and their mind were affected. There's no sun for them. It's air conditioned. There are filters to filter out the viral load in the air, but really, I don't know if any one of us have already have stayed in such a facility before, but I can't imagine the amount of depression and maybe even isolation and loneliness they can feel when in such facilities. The only good thing about these facilities is that each of their beds or their cubicles, as we call them, are open to everyone within the hall. So they are allowed to interact with everyone else inside there, basically, be it a care worker or their friends from the same hometown, even if they could find. I think Tulika would give you some pictures. I didn't want to give you a picture of their living conditions. They're really, I think they're really great compared to some of the other countries. And Singapore is fortunate enough to have enough resources for these patients. But what I wanted to show you guys today was how alive they can be in such a facility. You can see on the top right corner, if I can orientate you to the whole sharing screen, is that they're exercising. We do lead some exercising. Our physiotherapists come in. Some of the nurses actually started it out by dancing to some Bollywood songs. I can't show you the video. It's embargoed from my company. So, but it was really inspiring where the nurses just took over, started this Bollywood dancing, and a lot of them just followed along. And thereafter, we thought that we could structure these dancers or exercises, and we got the physiotherapist in to curate a set of exercises, 15-minute simple exercises for them, just to get their body moving. So that was born out of some creativity from a nurse. And then you can see that the halls, they're all covered up. Everything on top is just fluorescent lights, metal cladding. The walls are sterile white. There's some curtains and they are black in color, unfortunately. So it can get a bit depressing when you're inside. They used to play hall music, but elevator music in the halls. But after a while, people just couldn't stand it, and they wanted silence. Silence was better. I can show you on the left-hand side of the screen. Yeah. This was a makeshift table tennis. The residents, we call them residents. We don't really call them patients, but yeah. So the residents, they just stay with us for about 21 to 28 days or so, and look at how they improvise our tables and some cardboard just to make a table tennis, a makeshift table tennis game out of it. As you can see, even one of our nurses is just enjoying the match. On the right, bottom center right, they're playing badminton without nets. Yeah, I agree. It's much better to call them residents. Patients, most of them are not really sick. If they're really sick, we'll send them to the hospital. So yeah, residents sounds so much better. Agreed. At the bottom of the screen, I just wanted to show you the amount of creativity, the amount of artistic expression that they showed us. All we gave them at the start was just blank pieces of paper that we had in the halls for their medical records to print out some forms. We had that, we gave them that, and they gave us such beautiful art pieces. The bottom left, you can see that there's one big piece of paper there. That was the effort of a few of them coloring over a few days. So it's really beautiful. After the Ramadan period, we celebrated Shawwal, which is the Muslim celebration of the end of the fasting month. And we have had some decorations made by them, even a whole ark, just to usher in Shawwal. And you can see some thank you notes amongst all of these, and it really touches our heart to see that what we are doing is really making a difference. Of course, among all these residents, they do have some of them who are really depressed. Rather, they don't know why they're there. They don't know when they're getting out of it. So it's really, we need a lot of engagement and a lot of connecting with the heart and the mind, not just taking care of the physical body, their symptoms. Those are basic things, but more importantly, we found out that caring for the heart and the mind, that's really one of the most integral parts of these facilities at this point in time. Thank you.
Over to you, Marcel.
All right, thank you, Tulika, and thank you, everybody. I want to sincerely express my appreciation of you taking the time and listening to us and to our work, what we have been doing over the crisis period. And I'd like to share with you how I have been involved in the community that I have been supporting, and what Faiz has been saying is really a good background on the migrant workers, because that exactly is the community I am volunteering with. And I have been a coordinator for a charity organization called the Transient Workers Count 2. And it's a charity organization based in Singapore that assists migrant workers, predominantly from Bangladesh and India, who have either lost their jobs due to injuries or who have lost their jobs due to salary claims. That means they're put into a situation when they have no income whatsoever, but still they have to reside in Singapore because they're awaiting their compensation. And so now just imagine being in one of the most expensive cities in the world with no income and no support, really, no support network, no support system. So why did I start working with this community? I would like to give you a little bit of a background on this. I think I could relate really well to them. I'm a foreigner in this country, they're a foreigner in this country too. I never really understood why I'm called an expat and they're called a migrant worker. I think we are here for the same reason. I'm here for economic reasons, let's be honest. I've been working in Singapore for the past 8 years. They are here for the same reasons, right? I don't see a difference in that. And I really was wondering what their reality is like. And I saw a campaign one day about how they're eating here, what kind of food they're being given during their work on construction sites. And it wasn't good, it wasn't good. And made me feel like there's kind of two realities in Singapore for the migrant workers who come here for the same reasons, and then for other foreign workers who come here but just because of their background, ethnicity, status, why they would live a different reality. I never really understood that, like I didn't choose to be born white and male in Europe. Why should I have these privileges? And I think recognizing it is the first step to realize our privileges, and it's actually our responsibility to extend those to those who didn't win the lottery of life. We were not born, in this position by our choice, or it's not our achievement, right? And that's why it's our responsibility. So, a lot has been said about COVID being the great equalizer, but I think it goes both ways. It does affect everybody equally. Yes and no, actually. I mean, as you can see at the statistics in Singapore, 98% of the cases nowadays have been migrant workers, and that's no coincidence. That only you can see on the screen right now. That's the living conditions they're living in. It's cramped dormitories with no social distancing possible. Very, very little space to kind of have your privacy, to share bathrooms among more than 20 people, and that's why it's been affecting them a lot harder than everybody else. And so when this crisis hit, it was really them being affected the most. And yet they smile. And actually, Faiz said this, it's the spirit of the migrant workers. And thank you for this point. That's really, I have to kind of take a step back and say that this is why I'm volunteering. Like, you see their conditions. It really puts things into perspective, doesn't it? You see them going through such hardship, and yet they keep a smile on their face. And what you see, a lot more happens below the surface, the background. You have to think about the families they have back home. They're not here for themselves. They are here only, in most cases, to feed their families back home, who are dependent, whose livelihoods are dependent on the remittances that they're able to send home every month. And if this is cut, it's like a lifeline being cut to these villages. So not only these workers suffer, majority of the people who suffer is their families back home, who just don't have that income anymore, that monthly income that keeps them going, right? And so, and they still smile, So I work for the National University of Singapore. That's my full-time job. And I've conducted several interviews with the migrant workers to see the situation. I've called people from the S11 dormitory. That's the dormitory that's been affected most. There are 8,000 cases in one dormitory. Can you imagine that? So imagine staying in a place where there's no social distancing as possible, and you're surrounded by COVID-19, and yet that guy was so full of life, so full of hope, so full of just kind of positive thoughts, and I thought, wow, this is inspiring. So how we have been helping, yes, now we can see the photos of how we've been helping the families back home. So one of the migrant workers, like my dear friend, he approached me and he said, because now he's back home and he's been witnessing how all these people suffer because of the loss of the remittances, and they didn't have anything to eat. And he said the people are literally starving in those villages where most of the young men went to work in Singapore and other countries. The village was cut off. The village was starving because no money was going through. And so I organized a donation drive, and we fundraised in 2 days. We fundraised about 600 Singapore dollars, and I sent it to him immediately. That's the text. You can see how he has received the money. He bought the rice for the village, and yeah, that will keep them going for about 3 months, and that's great. One of the other activities we're doing is that we're donating mobile phones. We don't realize, but mobile phones for them is the only connection with their families. I mean, how does their family know that they're safe and how they're doing? How do they know their family is safe without a mobile phone? This is very important. And during this crisis, a mobile phone breaks down. Where are you going to get a new one? They don't have the money. Where are you going to get it repaired? So that was extremely important. So we've been trying to collect mobile phones and donate it to them, because it is, I think people don't realize how important this is to them. What I would also like to stress that the crisis has always been here in Singapore with the migrant workers. It's just that it is exacerbated with this crisis. And now the media spotlight is there, of course, and the public gives it a lot of attention. But what happens after that? I think the real crisis will come when the media spotlight fades, when the lights fade out, and then, well, nobody will be giving them any attention like it used to be before this crisis. How did we even get here? Not, to get it so out of hand, to get it so bad. I know people are donating a lot of money, and that's brilliant, and I love that. But where were the people before then? And it's not like people didn't know about their conditions; they knew. But now it just got exposed, and the media spotlight really drives people. Now it's great, but what's going to happen after that? And I think it's really after this that the real crisis will hit. And it's not only for the migrant workers communities; it's about every other vulnerable, socially neglected, economically deprived community that we are relying on, the workers who are the front lines, of this crisis, the cleaners, the ones we've always been making unheard and, kind of downplaying their roles in our lives and make them unheard and invisible, really. But those are the ones who are, because of whom we can actually have the luxury of just sitting at home and having these talks and, but they are the ones out there fighting, like my fellow MBA classmates. And I think that these are the people who need to be given stage now. I think that it's about time that we level the playing field. And that's what we're really trying to do here. So yeah, thank you very much.
Over to you, Mushan.
Hi, good evening, everyone. So I also study a part-time MBA, so I work in the healthcare sector just like Faiz, but I'm not a nurse by nature. I'm actually a healthcare administrator. So my main role in hospital actually is to run the head of operations in crisis management. So I would like to share that the story is no matter how well prepared that the country is or the public healthcare sector is, we're actually not really well equipped to handle the crisis at such a big scale. So today I'm just going to share about some of the stories that I have and actually just to drive across 3 points. I think the first point I would like to drive is the adaptability for our citizens as well as the healthcare worker. So initially when the virus struck in Wuhan in China in January, actually a lot of people are just still wondering like, it's a China thing and it will never affect us. But in the healthcare sector, we are quite mindful that it might hit our shore. And since January, before the Chinese New Year, actually my hospital already stepped up and we're trying to simulate and understudy how we can actually prevent the virus from coming in. And if it ever hit us, how can we even manage the situation? So it has been the 24/7 operations even before the virus hit the shore of Singapore, and we have been working towards how we can prevent it. But nonetheless, the virus still hit us, and I think it's about adaptability because a lot of us we wasn't sure how we can actually manage this situation, and not only that, initially our focus was in managing patients with virus coming into the hospital, but sooner than we thought. Actually, the virus was contained because of the lockdown measures by the Singapore government. However, as shared by my two classmates, the virus actually spread towards the dormitory and the residents in the dormitory. We have about 200 to 300,000 migrant workers staying in the dorm, and it isn't really easy to help to manage the virus. So instead of working inwards where we help to ramp up the services in the hospital, what we did was we actually moved outwards towards the dormitory. So we sent our troopers to the dormitories. We set up isolation facilities. We set up care corner facilities. So there's a lot of different operations that we actually set up. And in the healthcare sector, right, everyone is stretched. I would say that we are lucky because I look at many of my friends who actually lost their job during this crisis. And we are the lucky ones that we still have a job for us. But then we have to be very adaptable because a lot of times, whatever that we have planned for and work has changed, and we are never really sure how it will transform the work that we are doing today and how it's going to be like tomorrow. The second portion I just want to share is about commitment and passion. I think a lot of times, as what you have heard from my two classmates, right, it's really about the passion and the commitment that we have towards the work as well as the healthcare workers. I've seen how my colleagues actually spend days and night trying to set up the place and then moving into the front line, caring for the positive workers. And I even have doctors telling me that, they wouldn't want to go back home to their 1-month-old baby for the fear that they might spread the virus. And they actually choose to stay outside for the remaining months as long as they are caring for the COVID patients. So I think the commitment and the passion of the people that is working in the healthcare sector is really wonderful. And this is something that I guess all of us would want to learn and to bring it to another level. The last portion I want to share is also a story of gratitude. So we have a patient's cancer kid. So he survived his cancer, and his dad, actually, he was very grateful for the hospital. And when he get to know that we are actually setting up the facilities for the migrant workers, the father of the cancer kid, he actually gathered a group of his friends, and he just get loads of clothing, donated food, and he went out to buy everything that he could before the lockdown so that he can pass on this item to us. And the entire hospital was activated to actually help to pack the goodie bag so they can bring forth to the dormitories to give to these migrant workers. So I'd like to share that as much as I think Marcel shared about the conditions in the dormitories, I think they are gaining traction and people are noticing how the living conditions are. And I think everyone else is working towards our best to make sure that we contain the situation, as well as help the migrant workers who are actually the one facing the brunt of the crisis. And they don't have a good facilities supporting them, and we are actually ramping up the services to help them. And through this episode, I really feel that if we can stand together as one community, we unite and commit to help each other, I think we can fight this crisis together and win the battle. Yeah, that's all I have to share.
Thank you, all of you. That was really insightful, and I think all emotions coming together at one go. And I'm really sure that with all of the chaos around you and with all the hard work you guys have been putting in, the task was very demanding in terms of both time and effort. And now I would request the panel to talk about some key challenges they've faced and what were the steps they took to overcome these challenges. Starting with Dinda. Over to you, Dinda.
The challenges that I face is, to be honest, to manage the expectations, of course, of my employees, right? It's like the first. So I need to, take care of my employees, how they look at like this crisis, because no matter how much, like we said, we are on the same boat, the truth is we are not. We are in the same storm though, but we are not in the same boat. And I tried my best to communicate that with them. And then we just, we collected ideas together, me and my employees, so that we can overcome this crisis together. And we come up with some ideas actually, and the donation things, they also help me. So it is also like very heartwarming for me to see that even though they face the crisis themselves, that they need to take the unpaid leaves, but they still think about others out there that might be having a lot tougher challenges than what they are facing right now. So it's just heartwarming to see. But I think the communications with my employees, of course, are the key point in overcoming these challenges.
All right. So I think I speak on behalf of all healthcare professionals out there who's currently tackling this crisis. The greatest challenge was really being overwhelmed by the number of patients. I think we are still fortunate enough in Singapore to moderate the to not have a huge wave of a really huge tsunami of cases. But even then, there's this. The number of staff to patient ratio is really not ideal. We have one hall, 900 residents, sorry, 900 residents, and the number of medical and nursing team that we have is around 30. So that's 30 people to 900, and just very overwhelming. So a lot of it really depends on empowerment. As mentioned before, empowerment really is key. Just simple conversations with people can reveal answers to questions that you have. Many hands make light work. Even though they say too many cooks spoil the broth, but not really. If you really brainstorm with your team, people have so many ideas. What I mean by empowerment is that, well, we just speak to some of these residents with us who we see daily, and we now have like volunteer translators. We have some residents who can speak Bengali, Telugu, Tamil. It's really really fun working with him, and he helps us daily to translate. He's one of our residents. He's just volunteering his time because there's nothing else to do, and he feels that his time is better spent doing so. We have for meal times, we have long queues. We have long queues for the showers and for the water facilities. But we have like queue marshals. These are all volunteers. They just stepped up and asked us whether they can help to manage the queue, telling all their brothers, just queue up this way, queue up that way. Please don't cut the queue. And there are some of them who do cut the queue in any case. So really empowerment is key, and I think left to their own devices, they can really manage the whole show, less the medical part. But a lot of it really depends on the community spirit that's exhibited among all of the residents and the healthcare workers. Yeah, thanks.
Marcel?
Thank you. The key challenge for me was I was feeling a bit hopeless, a bit helpless, how to help the situation. I mean, I'm not a frontline worker, and during the COVID lockdown, I couldn't have just gone out and, visit the dormitories. It was not allowed. And under normal circumstances, I would have gone out and, organized outing with the workers, meet them personally. And I think the personal connection is very important. But now I couldn't have done it. And I was thinking how to adjust, how to just start things off, and I think it's important to realize that nobody has this figured out and everybody's adjusting. So if you think that you're lagging behind, you're not. We are all trying to adjust to the new norm. And for me, it was it was just starting off. It was really a struggle. But one thing that I realized over this journey was that I kind of thought that whatever I need to start, I need to carry on my shoulders alone. That is not true. I think that when you start something, there will be people on the way jumping on, on your bandwagon and just trying to help out, and just ask, and I think people get inspired by what you can do. I think it's important just to make the first step and not to look too far ahead about, looking at those complications and looking, what can go wrong, what may not work. And I learned this mindset actually from the workers, honestly. I mean, looking at their situations and how they always stay positive and how they do not look at obstacles, but rather look at how they can overcome them. This kind of mental resilience was truly inspiring. And that was the reason that pushed me and made me think harder about how I can help. So yes, we are all busy, we are all, having our own issues, but if you want to help out, I think that it really matters that you just start, and you will gain the momentum. For sure, you will start it off. And people are gonna jump, to help you out. And so, with the mobile phone donations and with the drive to help the village in Bangladesh, I didn't know how it would go. I didn't know if people would donate or not. I didn't know how I would send the money the most efficiently, if the guy would even buy the rice. I mean, there may be trust issues. I had no idea, but it worked out, and there are a lot of people helping me out. And I'm glad I didn't have to do it on my own. Why would I want to? Collaboration it's a great thing, and I can't know it all. I'm very happy if people play to their strengths, and so that was how I overcome this issue. So yes, you may think you're in this alone, or you may think that the steps you want to take are insignificant, but they're not, and you will get help. And it's just important to make that first step, and you'll be impressed how many people will come to your help and assistance. And truly together, we will make this, we'll make a significant contribution. So That's all I have to share. Thank you.
Mushan?
I guess, yeah, for my sharing is, I think things will no longer be the same as how we did before. And this COVID situation has really changed how we see things, how we do our business as usual. It's definitely not going to be the same anymore as we progress on a recovery phase. So my sensing is we have to be very versatile in what we are doing and never be afraid to challenge what is being presented to us. I guess the most important thing is to take the first step. Initially, when we were called to operations, we were also skeptical of how we can actually move to the dormitory to help out. It was on a Saturday call, asking for help immediately on a Monday. And the response from the team was a lot of people from the administrative side actually volunteered without having the clinical skill set. So we'll just help wherever there is, and everyone just volunteered. I would say that most of us are afraid. We are not afraid of getting the virus and dying from it, but rather we have family, young ones at home. And if something would have happened to us, we have the confidence in the healthcare system that is taking care of us. But what about the young ones that we might be spreading the virus to, or the elderly that are staying together with us? So a lot of us have this concern, but when the mission calls and I see the people volunteering for the mission, and we just have to do what we need to do, I feel that this is very inspiring, and definitely this is something that I would be very happy to share with my kids once they grow up, how this entire situation actually bring up the I would say the beauty side of a human being. Of course, there are ugly side as well, but my focus is always on the beauty side of how we actually survive through this crisis, and then how we can actually strengthen and bring up the spirit of mankind to help out one another in times of need. And this is something that is definitely a story that I can actually tell in generations to come. And this is something that the daddy, the granddad will be very proud of, that we are actually part of the team that actually survive the crisis together and volunteering our time and commitment. Yeah.
Thank you so much, team. And in our next segment today, I would like to request the panel to talk about their vision of a post-COVID world. How do they think that their involvement or the nature of their work will change? Starting with Dinda again. Thank you.
So as an entrepreneur in the food and beverage industry, of course, this COVID-19 situation will change the way we work all this time, right? We also, like right now are already trying to, kind of vision what is the new normal for us. So I think in terms of work as an entrepreneur, we need to always adapt things. Like, for example, previously my high-end dining restaurant doesn't offer delivery and takeaway. But right now, because I have also this responsibility to keep my employees not losing their jobs, then we create something to ensure that this takeaway and delivery can still happen so they do not lose their jobs. So I think in terms of work as an entrepreneur, there will be some changes, and it is up to us to keep adapting to that. And also, I really think after this, people will open their eyes that there are gaps, social economic gaps in Jakarta, where I live right now. And I hope that it will also motivate them to keep, helping each other, even though later, this crisis has passed, hopefully soon. But I hope this motivation to keep helping each other will not be banished after this. Yeah, thank you.
Yes.
All right, thanks. I think for me, not so much of my work or my involvement, but I would envision a post-COVID-19 world to be full of people who really count their blessings in life, who really appreciate the life that they have. As frontline workers, we see people losing their lives every other day. And when I explain this to people, they don't get it. They don't understand the sacredness of life itself. And I hope that something good that can come out of this crisis is that people really appreciate life and live their life to the fullest, or do something good like our panelists here have done with their own lives. And I'm sure a lot of many other people tuning in have done with their own. I mean, they made even small changes in their life to have positive change on the people around them. I think that's just enough, really. Thank you.
Marcel?
The post-COVID world, I think if this crisis teaches us anything, I think it is that we really rely on the support of the vulnerable, of the socially neglected and of the economically deprived, and of the ones we have often been making unheard and invisible. It really surprises me and shocks me that the migrant workers in Singapore, they are the hands that built up Singapore, and they are the ones who clean up the streets, who take care of, clean up the gutters, doing the dirty work, the demeaning dirty and, this kind of work that people wouldn't want to do. And where's the respect, and where's the respect for the cleaners? So where's the respect for the frontline workers? And I don't mean just respect in terms of social, but where's the economic kind of like remuneration that they really deserve? They're earning 400, 500 Singapore dollars, which is $300 a month, living in such vile conditions. It really needs to change, and I think that we must use the opportunities that this crisis has given us and to really benefit those, whom we rely on. And so, Mahatma Gandhi said a civilization is measured by how it treats its weakest members, right? And we should all figure that we are all minorities in some sense. We may be an ethnic minority in some certain context of social sense, ethnic minority, gender minority, sexual minority. You name religious minority. We are always going to be one or the other. We are, I think this is how we could empathize, how we could connect to the ones, and how we can step in their shoes to kind of understand what they feel like living here, and how we make them feel living in the society. We can all contribute to that. So I really hope that the post-COVID world will be one that will make us realize that we are only living this privileged life because of the sacrifices others made for us. We are only privileged in the way that we're not being discriminated, or that we are, because of the past bravery of our forefathers and foremothers who have fought for our place in our society right now. But a lot of people don't have that privilege. A lot of people are still struggling with it and fighting for it. So let's help them out. Let's reach out to them. We are accumulating, wealth, success, but how do we measure happiness? How do we measure that? I think that we really have to recalibrate our moral compass, and to really understand what's important here, to really do some introspection and with that reach out to the ones who need it most, because we don't realize, but we rely on them. We're in this position because of the sacrifice. Yeah, thank you.
For my case, I think I just want to bring back to what Jim has shared with us, being the agents of transformation. I believe that every one of us, regardless of our education, social status, language, race, or in fact religion, every one of us plays a part in shaping the society that we live in, and we are the agents of transformation. We are the agents of change. If we have that mindset to improve the environment that we are living in, and everyone just contribute every moment, every minute of their time, I would think that the place will be a more wonderful place for everyone. And sometimes we have a lot of aspiration to actually to help out, but no one just willing to take the, not everyone wants to take the first step out. And I believe that the initial to start is not difficult to overcome, as long as I think we are willing to step out, and we will be able to see the change we want in the world. And I think this is something that I hope at the end of COVID, everyone else can actually step up and do what we can in our little community. We need our social circles, and that will be able to influence the world we want to see. Yeah.
Thank you, team. So before we proceed to the Q&A segment, I really want to say, and very quickly, that it's important that we hang in there, because there is definitely a light at the end of the tunnel. These grueling days will definitely end. And most importantly, we will get through this all together. We will now take questions, and I open questions to the floor. Anybody with a question, let us know. You can type in your questions in the Q&A. So there is one question. What are the most important skills that you think that the next gen should acquire to mobilize the community more effectively? Anybody from the panel? Dinda, probably you like to take.
Yeah.
I'll quickly repeat the question.
Okay.
Yeah, sorry. Yeah, I'll quickly repeat the question. So what are the most important skills that you think that the next gen should acquire to mobilize the community more effectively?
In my experience, I think the skills that we really need to have to like mobilize community is one of them is for sure communication skills, because you need to give the message to other people why you are doing this and why their participation is also important. And I think if like that message is not conveyed to them, most of them will not understand and they don't want to participate, you know. So I think it is communications.
Marcel?
I think the most important skill is empathy. I think it's a skill. It's a very important, vital soft skill that is actually tied in with communication. But without empathy, how can you really convey what drives you, what motivates you? You have to be able to understand how people think and what's important to them, understand their values, and then communicate it in line with that. I think you need to strike a certain chord with people to make them inspired. And I think you can do that through empathy. And you have to understand, I mean, if I want to convey to people why it is important to help the migrant workers, I really have to understand it from the migrant workers' perspective first, and then be able to translate it in language that strikes a chord with the people that I want to mobilize. And that translation only happens through empathy, because you have to understand what motivates, what drives people, and what keeps them going, I think without that, it would be difficult to, to kind of convey, to kind of spark up the passion in people. You can make people do that, but to make it sustainable, to make it sustained, and to make it long-term, you have to reach for something deeper within people than just a request. You have to reach for striking a chord with their values and morals and moral compass, and show them why this matters. And that can be done through empathy.
Faiz, you would like to take next? Okay, Mushan? You would like to take a shot?
Yeah, I agree with Marcel on the empathy. And initially, I wanted to say maybe leadership by example, because if you do it yourself and others see that you do it, right, people will follow, and they will always follow a leader. And everyone is a leader. As long as someone starts doing something positive, you will be able to have a team of people doing the positive things in life together with you. So to me, maybe leadership by example is very important. Yeah.
Yeah. So the next question is, where would you like the world to be in 5 years? Marcel, you're on mute.
Sorry, yeah, I didn't realize. In 5 years, well, certainly not where it was before. And if you're building the new norm, rebuild it better, and we're saying, let's integrate minorities, let's integrate this and that. It's not about integration. It's about building the very foundations anew, taking into account their realities as valid and as equally important. We're not trying to integrate them within our value system. Let's just build it anew, right? Where do I see the world in 5 years? Well, certainly a world where values have changed dramatically and that the moral compass has been recalibrated towards a more compassionate society where values like, as I said, empathy and trust and compassion are the ones that drive the society. Yeah.
Anyone else?
In light of the recent events in the US, I really wish that the world will be a more prejudice-free, more open-minded, more unbiased world. And like Marcel has already alluded to, that empathy is one of the most important values to have. And I hope it will manifest itself in many, many ways. And one of which is really just effort to have an open mind to new cultures, new ideas, new ways of thinking, new ways of doing things, and accepting the fact that we are all diverse, and that in our diversity comes color and life. Yeah, I think that's what I hope. Thanks.
Mushan, Dinda, are you guys okay, or should I move on? Yeah. So the next question is, what has been a defining moment or experience in your life that led to your desire to make a positive difference in the world?
Maybe I can take that first. Sure. So for me, here in Jakarta, I live in apartment, right? So I live in the 19th floor, but it's such a drastic difference if you see out from my window, just right outside of my apartment complex, there are already like slums areas. And it was actually, for example, in the beginning of the year, there was a flood in Jakarta. Of course, like my apartment was not affected, but right outside of that, all those people just got affected by these floods. And at that moment, I actually talked to the management of the apartment to just, like open the gate and let those people just come in to just rest in the apartment lobby or like in wherever it is inside the apartment that they can use. So from that, I know that I want to do more to those people, because I know that there are like a huge gap, social economic gaps in Indonesia especially. So yeah.
If I can just share a story, if it's okay. So the pivotal moment for me was to really understand the power that I hold to change people's lives. And that came about 5 years ago when I was, when I was out doing an outing with the migrant workers, and one of them showed me a drawing, and I thought the drawing was great, it was incredible. But to him, it was just a hobby, it was like, I'd like to like draw things. And I said, you can earn money with this, like this is incredible. You should take it forward. You're so talented. And he just didn't know what to do next with it. He didn't see the opportunity in it. And I thought that he just needed a bridge of sorts, so that I facilitated, I got him, I emailed a school, an art school here. And then one of the teachers agreed to give him the, like art lessons. And then one of them ladies, she had an art studio, and people kind of came to his help, and he became much, much better. And guess where it is now? He broke out of that vicious cycle, and he's an art teacher in an international school in Chennai in India. And that completely changed his life. And that's when I really realized, like, keep your eyes open, like maybe people all they need is opportunities, that's all they're lacking. They at all don't like the talent at all. They're in fact more talented. I mean, yeah, like that's all they like. So that was the moment for me. I was like, okay, I need to give them opportunities, and I have the power to change their life, and we all do. We all can make our part, and if I can change one life, then it's just so gratifying. That was a great moment for me.
Mushan, Faiz, we'll move on, or do you want to answer? Okay. So the next question is, just in your personal lives, what have the challenges been? What are the challenges through these crises, and how have you dealt with it? Just in your personal life.
If I may share, I've recently been promoted to a dad in the last month. So that has been pretty challenging. I'm not sure if my wife is viewing this right now, but we're currently living separately due to the nature of my job. So as what Mushan has mentioned, I think the other thing, as all my our part-timers, part-time MBA classmates know, is that balancing the MBA and a full-time job, or rather a part-time job and a full-time MBA is kind of difficult. And Mushan is one of my group mates, and I really want to thank all of my group mates who have been really supportive in all the group works that we've done. I think having a strong support system really helps. Yeah, thanks.
Anyone else, guys?
Maybe I also share what Faiz has mentioned. I'm a father of 3, so the youngest being 2 years old. So every time I volunteer my service to the dorm operations, I always wonder whether I should return home. So I'll make sure that I get myself showered before I came back, and I try not to touch them for a day or so, but it's quite difficult. So I guess to same as Faiz, right? Having an MBA at the same time, having a full-time job, and with the COVID crisis, we are in the sector that while everybody is working from home, we are actually all hands on deck, fighting the battle together with the frontliners. So I think this is challenging. So I'm actually fortunate because, like I mentioned earlier, there are many people out there who has actually lost their job or are very badly affected by the crisis. So I'm thankful, and I hope that when the crisis, when we resume back to the normal steady state, I hope that actually the economy can pick up so that everyone can still, go back to their normal life, because there's really a lot of my friends who actually lost their job due to the crisis, and it's not easy for them. Yeah.
Yeah. So moving on, the next question: in which degree you feel supported by the government, and in which way do you think you may influence their way of thinking? Anybody want to answer that?
I would answer that, but it is in terms of Indonesia. So because I am right now in Indonesia, my movement is in Indonesia, and to be honest, I don't really feel supported by the government. And in fact, we tried rolling out this movement because we thought if we keep just waiting on the help from the government, we will be waiting forever, So then we think if we can do something, let's do it. Even if later the government gives something then it's okay, but we need to do something. So yeah, we really think that in Indonesia, especially the support that the government gives has also like gaps. So it is very hard to also like reach a lot of people. So that is why I really think that the more movement from the people that we can make, the better it is for, you know, like the larger communities. And I really hope that like the government hears this either in social media or from my friends that actually work in the government. And I hope they know that they still need to support the people. But yeah.
Anyone else?
I have to speak on behalf of all the healthcare workers in Singapore because the government has been really supportive. We have full PPE, we have everything that we need to fight this pandemic, unlike other less fortunate ones. So I really am thankful to the government in Singapore for really supporting, and they're really open to suggestions from the ground. We have had like a lot of meetings with them, with the agencies related to the government, and they have all been very supportive. And I think Singapore as a whole has risen and supported the frontline workers. And I really need to thank everyone who has been supporting all frontline workers, in fact, not just the government. Yeah, thanks.
Yeah, I'll move on then. So the next question is, what has been your most discouraging moment and most encouraging moment since you started your projects? How did you use the positive and negative? Anyone wants to answer that?
Marcel looks like he has something.
All right, discouraging moments. I think, okay, I have something to share. You know, so in my work with the workers, with the migrant workers, and as has been pointed out in the chat, we should not call them migrant workers and find something more socially inclusive, because I also don't like the term, but that's how we call them for now, so I'll stick with that. It can be that, you know, they're in a position of, they're in very vulnerable positions, and when you help them out, they kind of create certain dependency and certain dependent relation, and sometimes it can get okay, I'm talking about donations. You know, I'm talking about donations, like donating them money and food. You know, sometimes they just become kind of I don't know how I would put it well. There's been cases when the workers okay, so you give them money and then they just try to kind of expect more, you know, and I don't blame them at all whatsoever. And that could be discouraging because sometimes it gets into my personal life a bit too much. And I really always try to, again, exercise my empathy, you know, try to step in their shoes, how I would act if I were them, you know, and maybe try to understand why they're doing this, you know, and understand that they see an opportunity like, okay, this person can raise money for me, this person can provide this and that. And, you know, it's like you give them a finger and they try to go for the whole hand. And that's fine. I totally understand it. So I try not to be discouraged by that. I try to completely understand where they're coming from and, you know, try to give them as much compassion and understanding as I can. But it can be discouraging. Nevertheless, you know, sometimes you're trying your best and it's never good enough for them. And you cannot call them ungrateful at all. You know, like you don't know their situation, you know, you can't judge. So that also, I just kind of use this opportunity to also understand that their reality is different from mine. And I don't know how I would act in their place, and whatever they're doing makes sense for them. And I just try to use it as a learning opportunity. And it actually made me grow. And through these experiences, I've been able to understand so much better kind of their mindsets and their realities. So it was discouraging, but at the same time, I took it as an opportunity to learn.
I would take like the encouraging moment for me. So at first, when I rolled out this initiative, I actually did not tell my MBA friends in Singapore. So I just rolled it out for my friends in Indonesia if they want to support and donate the money, right? But then one of the friend in MBA actually posting that in the MBA group, and then suddenly, you know, like it was just like really heartwarming for me to see like everyone started coming, talking to me directly, saying that they also would like to support, you know, like even though it is not their country, it is not where they live, but they would like to support. And so that is like very encouraging, and that makes me think that what I do will really make a change. So yeah.
I think I just come in at this moment about discouraging moment, right? So while we paint a rosy picture of the community and everyone else working towards a common mission, but human beings being human beings, a lot of times different parties have a different agenda, and it's very difficult to align some of our working norms towards a common goal. So it's sometimes very frustrating, especially you have different task force and different parties going for the same mission, but with a different agenda. So when things turns ugly, and you know, sometimes you might start blaming each other for things that didn't work well. And I think these are just part and parcel of a big organization, especially everyone coming together for the first time, handling a crisis of such a massive scale. So some moments are very discouraging because whatever effort that we have put in were being dismissed, and because of a certain differences in our viewpoint, and we were not being accepted. So those are the moments that I would say are actually quite discouraging. But on the overall scale, because we have the common goal and the mission, I think we still move on and manage to overcome adversity with our fortitude towards the situation. Yeah. That's all.
Yeah. Guys, any more questions? Then in that case, thank you all for joining us today. And lastly, on behalf of the panel and myself, I want to express my gratitude to the NUS MBA team, and especially my fellow club vice president, Abby Ong, for helping us make this panel a great success. Special gratitude to Raji from the Humanity Rising team, and who's also an alum of NUS MBA, for inviting us to speak at the NextGen Leadership Week of the summit. If you have any further questions or comments, or like to engage deeper, you can reach us at our email, which is mbasei@u.nus.edu. Abby will post it on the chat too. And have a great rest of the day ahead. Thank you, guys.
Thank you, Tulika, for this amazing panel. Thank you all for joining us. Really, the conversation was super inspiring. And thank you for representing the change that we want in this world, literally. Seeing so many different stories, hearing about so many different stories, it's just, I think, inspiring for people in our time and generation to do something, to take action. And also thank you very much to point out the inequalities and the importance of empathy, of leadership, that sometimes are not taken into account when we're trying to make change. And yeah, and I think empathy as well was connecting to the heart, because empathy is really what connects us to the others, what makes us understand the other more. And that can also expand our vision, our consciousness. So that's really crucial. So I just want to remind everyone that our conversation then can continue on the Ubiverse. Matt, my colleague, has posted the link in the chat, but we will be posting it again. On the Ubiverse, I don't know if you've been there, but we have also a cool map that features, it's a feature where you can see the community members and where they live in the world, which I think is really interesting. And that can actually help you to connect to organizations or people around you if you want to get in touch with them after. So before we finish, I want to pass it on to my colleague Raji, who has helped organizing this amazing panel, and to Matt too, actually, who I actually want to say thank you to Matt, because he's not here with us now, but he's also helped a lot to organize the NextGen Humanity Rising Summit. Thank you all. And it was a pleasure to listen to you and to your stories. Ciao.
Thanks a lot, Nora. I'd just like to say a few words before I thank the panel, which I would love to do shortly. I just want to give everyone a quick preview of tomorrow's session. Tomorrow, Clover Hogan, representing Force of Nature, will be convening a panel. The Force of Nature is an organization that helps emerging generations step up rather than shut down to the challenge of climate change. And so that should be a really interesting session. Some of you that may have attended the first session of the summit actually may have heard Clover speak, and she's a wonderful speaker and a very inspirational person. Before we close, of course, I would love to thank the panel. As an alum, I am very proud and very glad that we could connect and that we could represent Singapore, Southeast Asia, and indeed NUS to the rest of the world. I just want to echo some of the thoughts that you said. You know, Marcel, you spoke, and everyone actually spoke about empathy and about creating a new world based on different values and based on feeling for others' needs. So thank you for saying that. And really the quote that stuck out for me and that I would like us to all remember, just in the context of even this week, we've heard from speakers, you know, from indigenous communities all over the world. We've heard from the jungles of Africa with the white lions. And today we've heard from Singapore, which is one of the beacons of an urban city in the entire world. And yet we've all heard all these different challenges and all these different inspirational stories and solutions as well. And so I would like to end in Dinda's words, and following that, just a 20-minute moment of silence, 20-second moment of silence, but just to celebrate that diversity, but also remember that as you said, we're in the same storm, but we're not in the same boat. So if we can just take 20 seconds to be grateful for each other's presence today, and just take that moment now. Thank you, everyone. And I will bid you good night, good day, good everything, wherever you are. Bye-bye.
Thank you, everyone.
Thank you.
Thank you, panel.